Okay, so where does a respiratory therapist work? There's a variety of settings, but a lot of the respiratory therapists work in hospitals, and we see patients in pretty much all areas of the hospital, including the emergency department. We treat patients who are having breathing problems there. We are very involved in all of the adult critical care units, and that can include the intensive care unit, the coronary care units, cardiothoracic surgery units, and other adult critical care areas. We also take care of pediatric and neonatal patients, and that can include pediatric intensive care units or neonatal intensive care units. Sometimes respiratory therapists are on the transport services, and that's moving patients from hospital to hospital. And we can do the coronary care unit. We can do that and ventilate them during the transport. We're taking care of patients throughout the hospital in the general adult and pediatric nursing units. And again, pretty much all areas we can provide care to patients in the hospital. Next slide. Therapists sometimes are employed in outpatient clinics or doctor's offices, but also these can be outpatient departments and hospitals. They can perform pulmonary function testing, which is a specialty within respiratory. There are pulmonary rehabilitation programs. Again, that's done on an outpatient basis. And patient education programs, smoking cessation in addition to breathing classes for pulmonary rehabilitation and other programs. Some subacute and long-term care facilities employ respiratory therapists, in particular if they have rehabilitation units that specialize in weaning patients from ventilators, or long-term care facilities that specialize in keeping long-term ventilator patients. Next slide. There are respiratory therapists that are employed in home care and durable medical equipment companies. There are a lot of patients that receive oxygen at home. It is also possible for a patient to have a home ventilator and be able to be at home in spite of the fact they need help of a ventilator. And there's various types of home respiratory therapists that a therapist can help with too. There are respiratory therapists that are in colleges and universities teaching students to be respiratory therapists, so you can be a clinical instructor or a program instructor for a respiratory program, and also in the military.